Have you ever thought you had a bump, lump, or a bone spur on top of your foot? Well, if your foot looks like this, well, maybe not even that bad. This might be what's going on. You can see this extra little bone formation, and I'm going to tell you why that shows up on your foot and how you can remove it, or at least reduce the symptoms. So a bone spur, here's a normal joint, or what should be a smooth joint. If you have abnormal friction and rubbing, just like a callus on a frictioned area can become irritated, swollen, and thick, same thing can happen to your bone. If it has abnormal tendon pulls, ligaments pulls, or rubbing, this can cause these types of bone spurs to appear. So why does it happen on top of your foot? Well, what happens is, as your foot's being pushed down by the Achilles tendon, so the Achilles tendon's pulling up, ground reactive forces are pushing up on the front of your foot. This compresses the top of your foot and stretches the bottom of your foot. So not only do you have bone spurring, pain, and numbness on top, but you have the plantar fasciitis, or heel pain, or arch pain at the bottom. So that's how this happens. You have high pressure on the front of your foot and your Achilles tendon pulling on the back of your foot, and this foot, the top of your foot jams, and eventually over years and decades you get this extra bone formation and this bump. You can also have at the top of your big toe the same thing form. You have little bone spurs, boom, same thing there. You can even have your ankle spur, the same exact mechanism all along the top of your foot. Any of these spurs are essentially caused the same way, and it's by the Achilles tendon pulling up and the ground reactive forces. So you can decrease some of these forces if you stretch out your Achilles tendon better, stretch out your foot better, decrease your body weight, any of these things. And same thing as the calcaneal heel spur. As your foot's being pushed up, it's stretching the bottom of your foot. That means the plantar fascia is stretching out, and over the years, the bone reacts to that stretch and forms a calcaneal heel spur. This is probably the most famous type. And that's due to your plantar fascia ligament pulling on the heel bone. So first thing you need to do, decrease the inflammation. So take some anti-inflammatories, ice the affected regions, and massage them. Now that's going to decrease the inflammation and allow you to stretch and control the biomechanical forces that are forming these spurs to happen. So next thing you want to do, get a great over-the-counter insert. There's a lot of crappy ones out there that give orthotics a bad name. They can even make your foot feel worse. But if you get a good pair, like I recommend a Power Step or a custom orthotic, they are going to make you feel phenomenal. And you won't be able to live without them, because you'll be able to stand on your feet maybe 2-3 times as long as you were before without pain. Next thing, once that pain's done, I mentioned before Achilles tendon is responsible. You want to stretch your hamstring, your calf, your Achilles tendon, and your foot, your plantar fascia. As it's more loose, there's less strain put on your bone. Next thing, as these things start getting better, like 2 weeks in, the stretching should really be helping you out. Start looking into a good pair of cushioned shoes that supports your arch. Get your insert into there. If that's still not working, consider getting a custom orthotic. You should get one of these anyway. I highly recommend it. If you're not having success with the stretches, everything's still sore, go see a physical therapist and continue stretching. They're going to teach you how to stretch. And if everything fails, and unfortunately this is the only way to remove the actual bumps, don't get me wrong, those treatments before will make you feel a million times better, but the bump's still going to stay there. If it's so huge that it needs to be removed, or you have some type of inflammatory arthritis, deformities, previous trauma, or broken bones that's causing this bump, you need to see your podiatrist. Surgeries these days are amazing. This bump can be removed. You'll be in a surgical shoe, but you won't even be off your feet, and you'll feel much, much better. And again, I'm not going to spend too much time, but losing weight also takes pressure off these things. So that was the quick guide, but if you guys want specifics on stretching, shoe gear choices, surgical options, and exactly what this bone spur is doing, check out DetroitFootPain.com. Sorry, the little M fell off here, but DetroitFootPain.com, we have much more in-depth videos. Good luck, guys. And surgery is the only way to fix this.
Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.